Now, today marks the end of the Teen Suicide Prevention Week. The program places a special focus on youth mental health, depression, as well as suicide. As part of its outreach program, the South African Depression and Anxiety Group visited schools in and around Gauteng to raise awareness about teen suicide. Zukie Cetywayo filed this report.
Teen Suicide Prevention Week is an important chance to bring educators, parents and students together to confront the grave issue of teen suicide. SADAG focuses on building hope and providing students with the help they need. Lack of support, home life, grief and bullying were highlighted as some of the contributing factors to teen suicide.
From our school outreach program, especially the project that we're running in Gauteng with the Department of Education, as well as the Matthew Guniwe School of Leadership, where we're visiting schools and high schools in and around Gauteng, we're picking up so many different problems as to the contributing factors to why a teenager may feel like suicide is their only way to end their problems. We know the key issues are around family, home life, abuse, divorce, separation, trauma, a loss of a loved one, and even issues happening at school, from bullying, whether it be bullying of learners. Sometimes we've even had cases of teachers, other learners. There's so many different contributing factors that our young people are dealing with, and they don't always have the safe space or the support system or the coping skills to actually deal with that. And that's when we're hearing of cases of learners who are taking their own life. And it's really sad when we're hearing children as young as 9 and 8 who have died by suicide.
When we speak of the challenges that kids face, I think one triggering thing is poverty and also lack of emotional support from home. Some kids fall into depression because of grief. You know, when you have unprocessed emotions, they stay in your body and you get to face them. Even when you don't have the awareness, and sometimes they become a cycle of thought in your head and become negative thoughts, and they become that critique force. One of the things is also bullying that kids face in schools, and just lack of support from parents and teachers.
Teachers have welcomed the initiative and believe it will assist them in dealing with students who are secretly going through depression.
The program is number one, ukuthi sikhona uku-identify abantwana abane-depression heavy, abantwana abahlukumezekile, abantwana abangana indawo abangabalekela kuyo ukuthi mhlawumbe bathole usizo. So if these things are brought to schools, you'll find that in most cases our schools don't have a therapist, they don't have people who have specialized to deal with traumas and everything. So Mawayeza on a consistent basis will be in a position of tracking down these learners so that we can be in a position of referring them to units in schools like school-based support teams, so that bazokhona ukusizakala ngendlela right. I feel ukuthi even the performance in terms of being assessed, they will be given a special treatment in school, so that we know that even if they don't perform well, we know that, for example, there are certain angles so that we believe that everybody can be in a position of achieving. But achieving in
learners have also blamed the situations at home, saying parents don't really give attention to their challenges.
Adolescent stage depressing ngempela udinga usizo angicabanga khona ukuthi ukuzibulala solution.
The more you bottle up, is the more you die inside, and they pretend it's not the way, because at the end of the day affects our wena. And the more you get depressed, like uba low self-esteem, which means like angeke ukwazi ukuba closer to your goals because you doubt yourself.
Ngizame ukuzibulala ukuthi ngizokwazi ukuzikhipha kwento engijongene nayo, but kufika khona la amaxesha ngiziba ayikho into engiyiphilelayo.
For Newzroom Afrika on Channel 405, I am Zukie Cetywayo in Benoni in Ekurhuleni.